Okay, time for the glute med tendon and the greater trochanteric bursa.
I'm going to show you how to scan the lateral hip, specifically for the tendon of the gluteus medius and the greater trochanteric bursa. So the patient position is side-lying, facing away from you, looking at the ultrasound machine, same as you are. The landmark is going to be your femur, quite distal where it's quite circular in cross-section. The orientation of the probe is going to be short axis on the femur, and the movements of the probe are going to be proximally until the pointy aspect of the greater trochanter comes into view. Now there's a bony landmark that's important, and that's the pointiest bit of this otherwise pointy bit of the greater trochanter. And the pointiest bit is going to demarcate the anterior facet of the greater trochanter from the lateral facet. The gluteus medius tendon sits on the lateral facet here. So that's how you scan for the gluteus medius tendon. Now the greater trochanteric bursa sits between the gluteus maximus and the gluteus medius, somewhere up here, but then continues around this way, continuing to lie directly on the posterior facet. So if we're going to scan for the greater trochanteric bursa, we can continue coming around the corner until we see the greater trochanter come to an end, and then we know the posterior facet lies between the edge of the lateral facet and the edge of the greater trochanter itself. And here lies a very clear way to reach or inject the greater trochanteric bursa.
Okay, excellent. So now let's draw it. So what do we have? Well, this is bone, and there's kind of our pointiest bit of the pointiest bit. This we would call the anterior facet. That's an awful A. But anyway, here's the lateral facet. Cartilage is no cartilage in view. Bursa, sure, let's do this. So essentially, I've got to go back a little bit because the bursa comes up essentially like this. Do you remember the subacromial bursa? It was kind of a white blip, if you will. Ligament, there's no ligament in view. Tendon. Well, here we've got the gluteus minimus tendon here. We've got the gluteus medius tendon here. And we should probably put in here that this is the tendon of the glute max, because this is the iliotibial band or the iliotibial tract here. All this stuff here. Muscle, well, this is all muscle here, the glute max. And, we can kind of see some muscle over here too. So that's a really messy one. So let's clear that away and draw it one more time. There is your bone, the greater trochanter. Here's your anterior facet. There is your lateral facet. I'm not going to attempt to draw an A again. There's no cartilage in view here. Bursa is essentially under the IT band, and it's this bit here. Ligament, there's no ligament in view. Tendon, well, we know this is the tendon of the glute min. Here's the tendon of the glute med. And here's essentially the tendon of the glute max as it grabs onto the IT band. And then muscle, this is all muscle here, and this is all muscle here. Okay, let's clear that away, and let's move on to a live patient. Oh, sorry, forgive me. Now we're on to the greater trochanteric bursa, the posterior facet. Okay, now let's draw this because we've come around the corner and we're looking at the posterior facet. So when you look at the posterior facet, this is still bone. I'm now going to jump straight to muscle because this is all muscle in view here. Well, what else do we see? Well, we know there's no cartilage. Bursa, let's try to draw the bursas. We know the bursa lies flat up against the posterior facet. So this is the bursa here. Now, there's no bursal fluid in there, so perhaps we should actually draw it more like kind of like that. Ligament, no ligament. Tendon, no real tendon in view. And muscle, we got tons of muscle in view. So we're going to clear this away. We're going to draw it one more time. Let's go from muscle. Let's go from bone. We're going to do bone here. Let's then do muscle. Well, this is all muscle here. And then underneath the muscle is the bursa, which is essentially, this sort of stuff here. Now, there's probably some anatomists who disagree with me and call this a bit of tendon, but for our purposes here in a learn for free sort of setting, I'm happy with this. So let's move on now and see what it looks like in a live patient.
I'm going to show you how to scan and inject the greater trochanteric bursa. First thing to know is the greater trochanteric bursa is also called the subgluteus maximus bursa. They're essentially the same thing. We like to find it at the posterior facet of the greater trochanter. Patient position is side-lying away from me. My landmark is going to be the proximal femur. My orientation of the probe is going to be short axis on the femur. I'm now going to slide the probe proximally towards the greater trochanter, keeping the femur nice and bright in view. I now see a very bright portion of the greater trochanter. This is what we call the pointiest bit of the greater trochanter. And specifically what I'm looking for, I'll now point out with the yellow arrow. I'm actually looking for the pointiest bit of this otherwise pointy structure. I'm going to slide and overscan a bit to make sure there isn't anything else that's really, really pointy. Now I've gone past that pointiest bit. I come back onto it. This now demarcates the position of the anterior facet of the greater trochanter, the lateral facet to the greater trochanter, and my final movement is going to be the following. I slide around to the posterior facet of the greater trochanter like so. In the center of the yellow arrow now is my gluteus maximus muscle, and the white bone there is the greater trochanter, and once again the posterior facet. I'll often do the injection with the needle entry here in plane, going down to touch where that yellow arrow tip is. Other practitioners may prefer to come out of plane with the needle entry angle like so, straight down to bone. That's how I find the greater trochanteric bursa. I'll now continue on to show you the gluteus medius tendon in the event that you want to inject that with either cortisone or PRP. We go back to our home position of the pointiest bit of the greater trochanter, and we know that the lateral facet to the greater trochanter is where the tendons of the gluteus medius attach. To inject these, once again, I can either place my needle entry point here, or I can come directly out of plane, straight down and touch the tendons there, right down to where that yellow arrow tip is. And so that's how I inject the tendon of the gluteus medius.
So now let's move on to the quiz. Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses, and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.